Thank you everyone for being here with us today. And as Mandy explained, my name is Melanie Shapiro, and I lead the community engagement team here. So I spend a lot of time around communities and patients and caregivers. So I was very excited to have the opportunity to sit with this panel today and to help bring to life their stories and experiences. And what we're going to talk about today isn't about awards, and it's not about polished work. It's about authenticity and responsibility. Advertising doesn't sit outside the patient's journey. It finds them at their most vulnerable moments. And for 21 grams, we have always tried to find the root of patients' experiences, right? It's in our DNA. It is what we've been founded upon. And we spend time learning what makes people tick so that we can truly connect with them in ways that are authentic. We make people feel, so therefore people act. And today's conversation is going to bring together industry, creative, and lived experience perspectives, and hopefully leave all of us with a better understanding of how we and our clients can be more effective in delivering messaging that matters most to the people who need it. And I know each of you had a moment to do for the audience to hear a very brief introduction about all of you, but I'd love to give you some time to maybe tell us a little bit more about yourselves and also why it was important that you participated in this panel today. So Kristen, since you're right next to me,
All right, I'll kick it off. Like Clay said, I'm Kristen Farina. I'm a creative director here at 21 Grams, one of many creative directors here at 21 Grams. And for the last 10 years, I've really dedicated my career to working in the oncology space. And what really drove me there is I love being on the precipice of what's next, right? Oncology doesn't have a cure, and every single day there's so many things coming out that can extend patients' lives and give them so much more hope than they had before, but we still haven't figured out how to cure cancer. And frankly, I want to be part of that, right? So that's really what drives me every day in this space. Interestingly enough, I had probably been working in oncology for about 8 years before my own diagnosis. So it wasn't what catapulted me to, focus on oncology, but it really has shifted my perspective and honestly strengthened the work that I do every single day. And I'm really excited to share a lot of that today with all of you.
My name is Anna. I am breast cancer survivor, storyteller, a mother, and work partner to Jordan. When I was diagnosed with breast cancer, it changed my life, but it also changed the direction of my work. I did not feel that I was seen in any materials that I was touching, and so I decided to create my own story about young family that is impacted by cancer. And the impact is not just on one person when you are diagnosed, it's all the people around you. Yeah. So that was very important for me to show that.
I'm Jordan. I work with Ani, obviously, and when she was diagnosed 10 years ago, I had never even really thought about what caregiver meant until people started calling me one. And that experience really kind of transformed my perspective as well on just everything in life that matters and how we can tell stories that both show the problem but also give people a sense of hope. And the work that we do together as a media production company specifically is intended to help collaborate and work with people who have experienced some of this and make sure that they feel like they're partners and collaborators in how their stories are seen and told.
Yeah, and my name is again Paul Barkita. I currently serve on the commercial marketing team at Ferring Pharmaceuticals under our Uro-Oncology division. Unfortunately, I lost my mom's sister, my godmother, to breast cancer a couple years ago. She basically was like my second mother, and then even more recently, both my grandparents, my dad's parents, both have had cancer in the recent time. And my product that we work on at Ferring is a product that is treated for bladder cancer, and my grandfather actually has bladder cancer. So it's pretty interesting that this is like the space now that I've been able to get into, where I was already passionate about trying to help patients' lives no matter what the connection was. And now the fact that I have the personal connection makes me jump out of the bed even faster in the morning. Because again, I'm not the person that's helping my grandfather. Luckily I've been able to get him in some really great care, which also has been helped with my grandmother's cancer as well, which is great. But but yeah, so the personal connection is also there for me too.
Yeah. I think it's a nice transition to my next question. So I'm going to start with you, but having that direct impact and even working in the space where your grandfather has been diagnosed, how has that impacted the way that you view pharmaceutical advertising?
Yeah, because so a little bit about before I got to Ferring again, I worked for a medical media company where we had 60 different franchises across all areas of healthcare, from oncology to pharmacy, managed care, whatever. So I, go figure, worked on the urology franchise, which helped me get to where I am today. So it's a platform called the Urology Times, where think of Sports Illustrated or the New York Times for news and information. It was that for urologists. So they came to Urology Times to learn about all the new medicines, all the new therapies, all the new data. So my job, again, in a business development role there, was to sell the media and advertising to the pharma clients, right? So again, what I learned from that is, like, again, it's this type of space is so important when it comes to a brand message. And because it's not just about a banner ad, it's not just about a print ad that they're seeing. Like, the doctors really, they want to be able to come to these types of platforms to get the content and information that they need to help make those right decisions, right? And so I learned really firsthand on that side. And now the fact that I'm really in the trenches with these thought leaders, part of my role in peer-to-peer marketing is to be able to engage with these KOLs and these nurses and APPs and whoever is in the treatment space. Where I hear it all the time that this really does matter. And without the great work, again, that you guys are doing, there might be opportunities where patients might miss the opportunity for a treatment that can help their cancer. So it's been really great to see that on the other side, and now being on the client side, it's now seeing it all come to life. It's been really, really rewarding. So.
Well, sorry, Jordan, how about for you? How did your wife's diagnosis impact how you viewed pharmaceutical advertising?
I really hadn't thought about it much until her diagnosis.
Yeah.
I just always saw the ads and thought they seemed kind of cheesy, truthfully. But it didn't really bother me that much because it wasn't my problem. And then it became our problem.
Right.
And then I recognized what a difference well-done campaigns and well-done storytelling can make in people's lives. I mean, it can transform them. And I know that when Ani was diagnosed, I started looking like, where's the people like us so I can relate? I couldn't find it. Yeah. And that's kind of why we started doing it ourselves. So it shifted a lot, and I think that there's some people doing really great work. A lot of you here are those people, and I think that these conversations are really critical because things change. And even when I hear the words patient journey, I find it kind of funny because that journey never ends.
Right.
Yeah.
And so I'm glad we're here today to talk about these things.
Yeah. And I know we've talked about this
Yeah,
a bit.
a lot.
Yeah, so definitely want to hear your perspective.
So for me, as I mentioned to Melanie, before I was diagnosed, I didn't see any commercials. Like, I just didn't see it. It was there probably, but I didn't care. It wasn't for me. And then suddenly it was for me. And suddenly I started to feel very alone because I wasn't there. There was no story about me. So as a newly diagnosed person, I had very hard time processing information. And I remember that people were always offering me some kind of leaflets. Yeah. And I looked at the picture and I'm like, nah, thank you. That person there, it's like, that's not me. Why would I even read it? Why would I even bother? And that's the impact that advertising in health has. So that when you're a patient, newly diagnosed, or caregiver, and you're looking for information, if you don't put the right image there, the person will not even read it because they will be like, no, thank you. And then you miss a lot of information.
Yeah, I think coming back to work after my experience and being in remission at that time, I definitely had a moment of reflection where I felt like the pharma narratives that I was writing and I was responsible for in the oncology space didn't actually live up to or mirror in any way my lived experience, right? And I think that was a really important point for me to kind of take a step back and think about how can I now be more authentic in what I'm writing and what I'm creating, because I have now been on the other side of it. And I think one of the biggest things that I think pharma does miss, unfortunately, is there's so much more than just being in like active treatment and you know, from like your diagnosis or your relapse till your progression, right? There's so much more happening around a person and for a caregiver as well. And I think that pharma has a really unique opportunity to step in and support more of that. Transparently, like mental health, I probably struggled with more after my diagnosis than like physical health, although it took a toll on my body. Like coming out of it, you know, cured or in remission was great, but it kind of hits you afterwards, right? Like this journey that you've been through and what it really meant. And I didn't find much support, you know, coming from anywhere. I had to go find it myself through therapy and different things that I went through. But you know, I think that there's a responsibility potentially for pharma to start thinking about what else they can do to support the rest of what's happening around a person with cancer, and not just, you know, the medicine that they're providing, which is incredibly important, of course. But, and I also think that extends into survivorship, right? And I think we'll talk a little bit more about that, but survivorship is definitely really hard, right? I think maybe there's a mentality of, you know, you're cancer free and that's, your life just goes back to where it was, and it never will, and it doesn't, but that's okay. I think it's just the lack of support and messaging around that is what I'm hoping that, you know, we can all take away and maybe even push our clients and challenge them to do more with.
Yeah, it's a little bit of the need to treat the whole person.
Yes.
Right? So you started to touch on this a little bit. When, as somebody who was diagnosed with cancer, what did you feel was missing most in how cancer was being portrayed in advertising?
I mean, so much.
Yeah.
You know, I think it's really the name of the game for this panel, right? It's like this authenticity that was missing. And again, like really that outside support of just being on like a medicine for a short amount of time. Like I said, I think that there is a responsibility to do more and support, again, the whole patient and the whole journey, and maybe even, you know, the whole family in that too. And potentially we have that unique opportunity to kind of work with our clients to do that.
Yeah.
And for you, Anna?
Authenticity. I did not feel, you know, you see polished pictures, you see very much polished end product, but you're not polished. You're no. You're a human being, messy human being that has emotions up and down, and that has to be portrayed in this kind of advertising, because health advertising is not selling Snickers. Nothing against selling Snickers, but you don't care about Snickers when you have cancer.
Yeah.
You care about life and death, and that's so much responsibility on people putting their the ads and everybody else.
Yeah, I mean, just to piggyback on what both of you said, for me, I think it's nuance.
Yeah.
It's subtlety. It's about those little moments in your life, not necessarily the grand concept or the big ideas. For us, it was like, am I going to be here to see my son graduate? Will I be able to do things that, you know, and I think that's important, that we recognize that it's sometimes those little things in life that really are the most meaningful to us, and how can pharma and how can marketing and advertising kind of make a little bit more normalcy in some ways.
Yeah.
And I think that's an invitation to others, because I think we all have our own different lives. No one has the same story. And that's why I think the nuance actually really does matter, because that's sometimes where we see the real truths.
Yeah.
Yeah, from my perspective, I mean, you guys do a great job of that here. I remember my first day orientation coming to 21 grams, just where 21 grams came from, the story of how the 21 grams, I was like, that's great. And trust me, on my other side, where I've worked with lots of agencies and for a lot of the agency, you know, mumbo jumbo, I was like, that's actually pretty good. Okay, I'll take that. Okay, 21 grams is like, and I looked it up immediately, obviously. I had to make sure you guys were fact checked, of course. Right, sorry, Claire. But and then the campaign you did with that really rare disease, where it was that mini short series. Again, forgive me for the disease, but it was about like the German scientists, right? Yeah. So like that's the kind of stuff. Like you guys are there, and yes, to your point, Chris, about like what can we do more from the pharma side? Like now, obviously not to defend that statement that there are obviously a lot of restrictions and guardrails that pharma does have to abide by, not only just internally but also with the regulations of the FDA and all that. But I totally agree with you guys that what can we be doing better? Because again, Anna, you said it too. It's not sneakers here. This is medicine, right? And every opportunity that I talk to a physician or a provider or a nurse or anybody, I've heard them literally say this, that if any opportunity that they can sniff out that somebody's not being genuine and somebody's not being real with you, and that's not just obviously with medicine, this can be anything, but obviously when it comes to medicine, that is almost more of a deciding factor on whether or not the type of decision making that they're going to do. It's the truth, and it comes a lot of it from the marketing materials, from the different campaigns that come around. These are the types of things that these providers are thinking about because they care about their patient, right? So again, big theme I always say is putting yourself in the shoes of the patient, of the HCP every single time when you're going through this process. So.
Yeah. I think one of the things that I'm hearing a bunch is the importance of authenticity and even highlighting lived experience in advertising. And I think it's something that we do well here, right? And one thing that I've learned from working with these wonderful folks is that type of authenticity and lived experience doesn't always need to be a talking head video. It doesn't need to come through in a patient testimonial. There are other ways to connect with audiences, but it means really truly understanding them at a deeper level, right? And then thinking about the best way to connect with them. And maybe it's through a social trend, or maybe it's, stringing together a collection of narratives to create one unique story that represents a community. But curious to know from all of you, when you think about authenticity in healthcare advertising, what does that look like?
Yeah, I mean, I think that we should look for opportunity to tap into emotions that aren't hope, right? Cancer patients don't always want to hear like, there's hope here, there's hope here, there's hope here, right? And I think that you shouldn't be afraid to laugh. I don't think you should be afraid to make someone who has cancer laugh. That's okay. I always like to talk about this, but I think I mortified my family when I told them we would be taking a humor after the tumor approach to my cancer experience, and it wasn't to look back and like make fun of or anything, the journey that we had all been on. It was honestly to give permission that it's okay to find joy right now, and that we actually needed that to fuel us in a way through this. So it doesn't have to just be limited to this one emotion that we see through pretty much every single piece of cancer advertising I've seen and what I've worked on as well. It doesn't always have to hook on to hope. And in fact, I think it would be really welcome for people with cancer to see things that maybe tap into different emotions for them as well. And to your point, like, we do not need to just throw a person into it who's a patient, right? That isn't the solution. It's just, again, becoming really authentic and figuring out, uncovering everything about that group of people so that you can come with like the most honest and relatable, creative that you can.
Yeah. I agree with you with the hope.
Yeah.
I mean, there's so much hope, and it's just like,
Okay.
thank you. Yeah, I hope too. That's how I felt. Like, yeah, I definitely hope I will survive.
For sure.
So you don't have to tell me that I should hope that I will survive. So authenticity is something that has to come from like inner feelings. It has to come with from discussions, but from listening.
Yeah.
And listening to people who are actually in that target market, right? You're trying to target people, and you have to listen to them. You have to uncover their stories. So that's actually why we started to do our own story. And now we are using our story as a framework to tell other people's stories. We ask them questions. We look at them as a real people with real problems.
Yeah, real people I like, because I hear a lot the word consumers.
Yeah.
Yeah.
And it turns me off a bit.
Yeah.
Because, I mean, the consumer feels to me like by choice. If I need medication because I could die, I just don't, I don't know, I
Yeah,
don't
there's
perceive
no
that as
choice.
me being a consumer. I'm a human being who has an unfortunate situation that they're navigating. And authenticity for me, it's collaboration, and it's like what you all said, it's listening and not bringing your ego to the table and not trying to project what you want this to be about. You know, we've been on calls where people told us what cancer is,
Yeah.
but they didn't ask us what cancer is. And like that's what I think authenticity looks like. It looks like listening.
Yeah.
Yeah.
From our side is that a lot of people, again, farmers sometimes gets a black eye on, to your point, like, oh, we look at patients as consumers because we're all in this for the money and the opportunity because we all know people get sick and people die. Like, that's so not true. And now, again, being on the inside where some of the people that I meet and I work with are some of the most brilliant people that I've ever met and could probably ever meet. And they've decided that they utilize their talents and their abilities to be here to help save people's lives and help treat these diseases. So that we do care. And whenever interaction that we'll do, whether it's internally or obviously, you know, with providers and even with patients, it really comes out so much that we really do care. And all of the old clients that I used to have, it's all the same. But it's a big challenge that we all need to really figure out. Like, how can we really deliver that message of authenticity? So it's a tough question, but I think it goes back to really listening and, you know, not a one-size-fit-all kind of approach, right? Because obviously breast cancer and bladder cancer, it's all different. Yes, it's all cancer, but it all affects different things when it comes to the medicines and all that. So, but yeah, I think it can never be real. Like the humor to the tumor is a perfect, I love that,
Yeah.
right? So, like, I remember when I was in the office with my grandfather, first day, again, his first appointment, and he's an old school New Yorker from Brooklyn, cop, doesn't take no stuff. All right, doc, tell me what I'm getting into, like, right now. I want to know about this, right? I'm like, Grandpa, you can't talk like that. This is like a very, very high established, like, thought leader from, you know, massive New York City hospital. You can't just come in and then say that. Like, just listen, right? So, but again, just tell it how it is. That's what we want to know. So.
But I think, Paul, you kind of teed up one of my favorite things to say is that cancer patients are not a monolith, right?
No.
Yeah.
And you see these tropes often associated with it, like bravery, fight, hero. And honestly, like, was I brave? Sure, I had to be brave, right? Was I a fighter? I don't think I fought much, and certainly wasn't a hero, right? I think the people around me treating my disease were the heroes, not me. So I think you have to really strive to get deeper with it. And to your point, that is what 21 grams does so well. It is at like the core of our ethos is to, you know, get to the 21 grams that make people tick and find out, you know, those deepest insights about them. I love talking about this, and it's not my experience, but it is, you know, a brand that I have worked on. I've been working in breast cancer for a while, and I think the first thing people think about with breast cancer is like the pink ribbon, right? It's like the rallying cry. It's, you know, everything is around this like pink ribbon, and it's kind of associated with breast cancer as a whole. But when I started working in triple negative breast cancer, right, a subgroup of breast cancer, we actually found out on our team that pink ribbons do not resonate with that very specific subgroup and that very specific patient population. And the reason behind that is because they feel very left behind by science. They don't have the same treatment opportunities that people with potentially HR positive, HER2 negative have. And it didn't feel like something that, although they were people with breast cancer, they couldn't really get behind this pink ribbon. So I think it also goes to show that you need to get so granular with your insights, right? You can't just say like, this is a breast cancer insight. I think we really have to go deeper and think about subtypes, what drives each part of the disease, and you'll actually uncover even more interesting and diverse things about those people. But again, it is what 21 grams does so well. Get to that deepest place, and then, you know, you'll create better work that really actually resonates in that way. And you don't have to put a patient in it.
Right.
It'll still be relatable.
Yeah. Yeah.
I just wanted to add that pink ribbon does not resonate with a lot of people.
It's a very triggering symbol,
Yeah, it
I
is.
found. Yeah.
Like wrapping up
cancer or the
cancer in
blue, yeah.
pink does not make it more digestible.
No. And I talk about it all the time because I don't think everyone knows that it can be really triggering to people even in the breast cancer community.
So while patients themselves maybe don't need to be the focus of every advertisement, right? There is something to be said for delivering upon their lived experience, right? And why do you think that is crucial to advertising?
I think it builds trust, first of all, with the brands, right? Because if you can look at a brand and say, well, they actually get me and they understand my experience, I think you're more likely to maybe even like think about going on that treatment or going forward in that path. And I think it also takes out a little bit of like the loneliness that you feel as someone going through this, because you have something to look to that isn't, you know, your immediate family and the people supporting you, that actually gets you.
Yeah. I think it's very important in every stage. You know, you were thinking about the idea of a commercial, of an advertising. It's important to have somebody who lived through it. Then you're executing, that's crucial, because you can have a great idea, but if you don't execute well, then it falls flat.
Right.
And the end product is not good. So for me, like being on the set, executing with people who are like me, like who had cancer, who heard the words, I had cancer. That's crucial. You're there to protect their dignity. They're giving you their stories, and they don't know what will happen to their story. They're opening up the most painful parts of their life, the biggest fears they had. So having somebody who lived through it there is unbelievably powerful. It also tells them, this thing tells them, I care, and I will take care of your story.
I think also lived experience helps pharma.
Yeah.
And I think it helped because we've met a lot of really incredible people who also have lived experience, who are working within pharma.
Right.
Yeah.
And they care just as deeply as we do
Yeah.
about the outcomes. And so I think the lived experience actually helps them do what I think many of them really intend to do, which is help as many people as they can. And I think the lived experience is the secret tool to do that, because if you don't really understand the pain points, how can you really help those people to the best of their ability? And you know, I think of my sister, because she's an oncologist at Memorial Sloan.
Oh, wow.
And we were talking once, and she said, you know, Jordan, we hope the medicine's going to keep people alive, and we hope as doctors we can keep them alive. But art is what makes people want to live. And so I think that's where the lived experience is really important. If people see something that reflects what makes them want to live,
Yeah.
that's going to just help outcomes.
Yeah. And I remember when we spoke to, and Kristen just touched on this, we talked a lot about the loneliness that people feel, right? And how hearing other experiences or feeling like somebody gets you can really help with that loneliness too.
Yeah, there's a lot of research now with peer support, and they're just seeing it. We're working on some projects, and like, what's interesting is even across different cancer types, what's interesting is that they just need support. It's not always important that you have my cancer, but
Yeah.
people just need support from the cancer community, and peer support is this really incredible tool that I think is increasing in its usage for supporting that mental health gap, because it's very real, and it's very much why the work we do and why we present it the way we do. This is one of the top issues I think that we need to be really focused on, is the mental health piece.
Yeah, I agree, because we have so many support systems and programs. I think we touched on this a little bit ago, but that's tied to the medicine, like access to the medicine, reimbursement to the medicine, training how to administer the medicine. Like, yeah, that's all necessary and that's all great, but then what happens after that?
Yeah.
Right? And our medicine's relatively unique, where you're not taking it on a week-to-week basis. We take this more on a more monthly basis. So there'll be a lot of cases where patients not coming into the urologist's office for a couple of months. So sometimes that could be a little scary. Like, I want to know what's going on. So like, what can we be doing from pharma to, again, be there past just the medicine space, right? And we have a couple of patient advocates that we have, and every time I hear them talk about their experience with our product, like you can't obviously not cry and get goosebumps because it's hearing real patient stories. And whenever we talk to them, it's about forming this community. And I think we talked about that. And I know that's something that I've been pushing, and all of our teams have been pushing. But what does that really look like, right? In terms of a community, like we touched on it before, like a social aspect, or supporting some of the patient advocacy groups through all the different disease areas, creating our own patient advocacy group, right? Because it's not like, again, we don't care. We definitely do. It's just so hard and tough to really navigate on really what that really good looks like from the lived experience. But I mean, you touched on it, right? Because we do care. Like I touched on this before, but it's hard sometimes to show that we care with some of the basic type of things that you'll see from an advertising media perspective. So.
Yeah. And I'll just add too, because I know in your work, Paul, you work with a lot of providers, right? Mm-hmm. And I think their experience is important too. That lived experience matters, right? And maybe even the crossroads of where patients and providers have commonality can help.
I mean, part of my role is whenever I have an opportunity to engage with a provider, and most of the time these are the big KOL speakers that you'll see on the podiums and all that. And yes, I'm there to find out what could we be doing better to support your practice, what could we be doing better to help support your clinic, what can we do better from a messaging perspective, a strategy perspective, all that kind of basic marketing type of things, which is part of my job. But I take more pride and personal interest in more getting to know them on a more personal level, because even though these are some of the biggest international thought leaders in bladder cancer, they're still people too, right? And so that's something that I always want to make sure that I'm connecting on a personal level, like how's it going with your experience, right? Because yes, the patient's of course most important, but let's not always forget, and it's not just the provider, it's also the nurses, the APPs, the operations individual, it's the admins, it's the entire multidisciplinary unit that makes what we do and how we operate on a good basis. It's not just all that, so.
It's so important, right, though, what you're saying, Paul, because then that allows them to be better providers for us, too, right? If you're providing that support to the care teams.
Right. This is so important because the time we're in now, the amount of medical mistrust and distrust. Right. We're actually working on a project on that, too. Because there's actually this interesting division between mistrust and distrust. I get them confused, but one is when you've had an experience directly, like your doctor dismissed your concerns or whatever, and now you don't trust the system because it happened to you. And then there's cultural trust issues where maybe it didn't happen to you, but something happened in your community and you don't trust the system. So this is like, we're at the worst I think I've ever seen with mistrust and distrust, and that's so dangerous because that means people might not get checked when they should, or they won't believe what doctors are saying, and so that's why I'm so passionate about this. It's like if we can create better communications across the medical professionals and the people experiencing it, everyone will feel better because our doctors are being crunched too.
For me, like there is one thing that's very important, and that's who is going to be a better commercial for you than the patient who was happy, the patient who saw themselves, and then they will be talking about, oh, that drug helped me, and that patient is in community. So you are creating a whole system of your own spokespeople that you don't even know about, just because they might have a good experience.
Right. And they felt seen and understood.
Exactly.
Yeah. So when advertising gets this wrong, what does that look like?
I mean, definitely those happy, smiley patients running down a beach for sure.
That's a good one.
Yeah, that's the baseline here. But I think it's also potentially like, I struggle sometimes with the actor portrayal of things as well, because even though these are people who are trained to do these things like videos and come into a role, it's still hard for them to capture what we've actually been through. And it is a little bit also leaning a little bit more polished than, to your point earlier, like the messiness of our lives. So it is hard to like sit in front of the TV and just see these ads that honestly all look the same, and you don't really connect with any of them.
Yeah, it feels like there was somebody who had an idea, and they executed on the idea without even asking, without involving the community in, without listening. I just saw this one commercial, and it was just like that, like everybody else. Yeah, the sunset is good.
The sunset,
The
yeah.
beach,
I think
redwoods.
I think sometimes you might not even see what bad advertising looks like. And what I mean by that is, you know, we were speaking about it, we met a woman who was in her 30s, and she had symptoms for years and didn't get it checked out because she never saw another person who looked like her in a cancer commercial. So that's, for me, when we get it really wrong, when we're not representing fully
Yeah.
the amount of people that could be impacted by this, and we hone in on a certain kind of way of representing something, and then other people take this literally, because people are visually literate people, and what they see is what they understand sometimes. And if you don't see yourself included in the conversation, you could be 2 years into a metastatic diagnosis that you could have gotten treated much earlier and maybe had much better prognosis.
Yeah.
I mean, look at colon cancer right now, right? The
Yeah.
demographics are changing so much, and people are getting diagnosed much earlier in life, like 30s. Actually, my old art partner from my previous job, he was probably 34. He had colon cancer, and he would never have known, but he had other symptoms that made him get checked out. And I think, to your point, the demographics are changing so fast, but who we're portraying isn't changing at all.
Yeah.
So it's even less likely that someone is going to say, that looks like me, maybe I should think about this.
Exactly.
I want to talk about a little bit what good can look like, right? And we've talked a little bit on this panel about the importance of spending time with communities and what that can drive. And I know in my own experience, you know, Paul, you brought up the Friedrichsbach project, right? And that started, we did a panel discussion with a small group of FA patients, and we sat down over breakfast and we just had a conversation with them. And as part of that conversation, there was a young girl in the room, and I think she was about 25 years old, and she was very severely progressed, right? And in the room, she said, I can laugh or I can cry, and I choose to laugh, right? You know, with everything that she was faced at, she just wanted to have humor. She didn't want to always be reminded of where she was in her condition. And, you know, we took that insight and we brought it back as an agency, and, you know, that became the precipice of building out the Friedrichsbach, you know, series. And it really connected with the community on such a deep level. And we spent a lot of time checking in with them throughout the process, right, to see how they were going to react, how this was going to resonate with them. Because one of the other things we heard was, don't try to relate to us. Don't try to laugh on our level, right? You don't have FA. It's not going to come across.
You don't have the
Just
trauma.
make us laugh,
Yeah.
right? And so it was really important to partner with the community and to make sure that they understood, or that what we were producing was something that was going to relate to them. And they loved it. And it, you know, we had so much positive feedback. And, you know, we even partnered with, there's a comedian who has FA, right? And we partnered with her, and you know, it just resonated so well. But it really was because of the time that we spent just hearing from them. And Anna and Jordan, I know this is, you know, fundamental to the work that you do as well. So I'd like to maybe hear a little bit from both of you how spending time with communities has impacted the work that you do.
It just does. It's, yeah, you can.
No.
Yeah, it does. Like, also comes because of my lived experience and Jordan's lived experience, and also our own vulnerability, where people know that we tell them, look, I lived through something. If it's not your disease, it was something serious too. And it just shows. And, you know, we always say that it's great to reinforce what was already said, but the new thing is to uncover what wasn't said, and that's how you get people. And you get them because you are open, you listen to them, you invite them to every stage of your production. You don't just tell them, okay, here are 5 ideas, what do you think? These are 3 names, what do you think? You ask them, what do you want to see?
For me, it's also about bringing them into every stage of the process. And it's, you know, the ideation, the discovery, kind of what you discover. I also think it's exciting if you can document that process, because
Yeah.
I think it's one thing, and broadcast that you had that process. Something I think people don't do enough is explaining the process.
Yeah.
Like, this is how we built this as well. I think that actually is an important part to building some of this trust. But bringing them at every stage, and like even if before a shoot, what we like to do, we send them a little bit about us and who they're going to meet and who they're going to maybe be working with. And then when we're together, everything we can to make them comfortable. And then there's even a project we're working on now where they're helping us edit, which is like kind of
That's cool.
we haven't done that one before, but like it's been cool. Like they're using Frame.io with us, and like they're chiming in with some ideas, and we're listening. And it doesn't mean we'll take all their ideas, but they're not expecting us to. They just feel included. And what I'm seeing now as a result is that from that specific project, and we've had other projects like that, but not with the editing, there's so much more of a feeling of ownership, so they don't feel like they were participants in the project.
Yeah.
They feel like it's the project that they helped work on.
And they're very proud of it.
And they're proud of it, and they want to share it, and so they're going above and beyond even whatever the agreements were with the companies about how they would share the work. They're like doing it all the time because they're really proud of it and they feel included. So that's an example, I think, of how it can be done effectively.
I mean, Paul keeps talking about how great we do it here, and I think you're right. But we have to
Keep talking about it. Maybe it was one. I'm trying to
I'm
kiss
just gonna
him.
keep saying that. But
We heard it several times.
yeah,
but-
I heard it several times. But we do two things at 21 Grams that I think allow us to listen better and honestly makes us kind of step apart maybe from what other agencies might do. And you know, we obviously do classic market research. We've all experienced that, but we do something called 21 Grams dinners, which is the opportunity to actually like break bread with either the people affected by the disease or the treaters. And I think when you're having more of like a fluid conversation over a dinner where you're actually eating, you're having that meal together, it does break down a lot of those barriers and you're able to listen so much more and differently than if you were in like a classic market research setting. The other thing that we do that I'm honestly obsessed with and I wish we did more was the 21 Grams Uncovered series, where we actually use a investigative journalist to follow, again, either a person with a condition or a treater of it for the entire day and just kind of be there to observe, right? Interact with the people that person's interacting with. Maybe it's their family, maybe if it's a treater, it is their patients, and just to hear like sun up to sundown what their experience is. And again, I think that gives you such a different perspective than behind the glass market research. And I don't know, we should start doing Uncovered more because I've learned so much from the ones we did, and it's really just, again, amplifying that ability to listen to what the people want to see.
Yeah.
I would second that. You guys should be doing that more often than not. I mean, just like how for us, and that's part of what my role is to manage all the insight generation activities. Like, we are trying to get insights every single moment of the day possible, right? Whether it's a dinner, it's an ad board, it's a, I just bumped into a doctor at a conference for a coffee, and we're gonna get an insight from that, because that's how you constantly are evolving your brand strategy. That's how you're constantly looking to get better. It's wanting to hear from the people, like you mentioned, the patients and the providers, the people that are gonna ultimately make the decisions on what's effective advertising and marketing. But the important thing is also not getting what you want to hear.
Yeah.
Yeah.
Which it's always nice what we want to hear, right? You know, you look so great, you know, like, well, whatever, but tell me how it is, right? I don't know if that's just New Yorkers, that's how we just tell it how it is. But that's, I think one of the important things to your point is, yes, those activities should be being done all the time in any opportunity, but it's also, again, the important key is you want to make sure you're getting what you need.
Yeah.
Well, and one of the things I was going to say, which you just teed me up perfectly for, Paul, was the dinners and that we do are unbelievable. But spending one dinner with a community does not help you understand them fully, right? And I think one of the other offerings that we have within the agency is what our team does, is what the community engagement team does, right? Our approach to how we support patients and caregivers is different than, you know, what maybe typical in the industry, in that we do invest ourselves in the communities that we're supporting in their lives and spend time with them. And oftentimes those deep insights, those are in the Uber rides on the way to an event, meeting them for coffee or for breakfast, but really just spending time with them. And it's over the years. I have ambassadors that I've worked with for 7 years. So just think about how much you learn from a person. But we put a lot of effort into building relationships, and we don't own those relationships. We may be the ones who hear the information, but that's information we then extend to our teams to help generate that impressive work that we're able to create.
I mean, I call my oncologist all the time, and I'm like, what do you think about this crazy idea? And she's like, okay, yeah, that's really cool. And it's so funny because she always says she's like so impressed with the work we do. And I'm like, well, I'm really impressed with your work too. But yeah, I think it's really cool to have that ability to be able to just call someone up and be like, let me run this by you. In your professional opinion, what do you think?
So interestingly, for the four of you, what I thought was going to happen is happening. That hour flew. And we are an hour in. So I want to make sure that we take a moment before we wrap the session, and if there's questions that we'll have time to take. I want to make sure I give you the opportunity to share any final thoughts, anything we didn't talk about that you really want to be able to share with the group today.
I mean, I feel like I put it all out there for you, but I guess what I would say to close out is, honestly, I would challenge all of you in the audience, right, to take what you've heard from, two people who've been through this themselves, and then two people who, caregivers, and have been really close to people who've been through this, and honestly use that as the jumping off point to challenge your clients to start thinking about what more they can do in the pharma world to support those going through this. I think it'll look different for disease states, and what that could be, but I think you have a really big opportunity and, like I said, a responsibility to do that.
For me, it would be, don't also forget about the people around the person who's diagnosed. You don't, with your talks, with your advertising, you're not just talking to them, you're talking to their partners, you're talking to their children, you're talking to their friends. So don't forget that part, and just listen. And I mean, we are on this panel, so I mean, this is amazing to even have this panel and to talk about these responsibilities. So I don't know how much I should enforce that you should be doing what you're doing. But yes, it's been, it's true.
Yeah, just thank you. I mean, I hope we can keep pushing clients and people to not just keep saying what's easy.
Yes.
And to also remember who's the most vulnerable people, and do our stories serve them?
Yeah.
Yeah, I think for me, and I might have touched on it a little bit earlier, again, I can't believe how fast this hour really has come by. And I think all of you do know this, and for all you watching, you know this, that you decided to embark in an industry and a career that hopefully has a purpose, right? What you're doing every day, you know that you're making a difference. But as we all are humans, there are those days where you wake up on the wrong side of the bed, or something happens on your commute and you're like, why the heck am I even doing this anyway? Does this even really matter, right? Because I used to get those thoughts all the time, especially when I was on the other side, when I was selling the media and advertising to the clients, like, are the urologists really going to watch this video? Are they really going to see this campaign? Like, all those negative thoughts. And then obviously I had to psych myself back into the positive side, and knowing that they are. And even if they weren't, I still remember that this really does matter. Now getting on this side, where again, I'm enwrenched with the providers and the nurses and the patients in a lot more of an intimate way, it really does matter. And without what we do, without the healthcare media, the advertising, the marketing, all that, again, the healthcare ecosystem does not operate the way it operates to the highest fashion without you guys and all the hard work that we're doing. So in those tough days where you may not feel like it, or you don't have the motivation to get out of bed or do something like this, it's remember that it really does matter. And we are really fortunate to be in a position where we have the ability to market medicines and things like that, to not give patients an opportunity to take advantage of these great work that all of these physicians and the scientists and everybody that does in bringing these medicines to life. So, but yeah, that was it.
Well, thank you all so much.
How do the advocacy groups evolve? Maybe and is advocacy for the patient, or or are they still pink ribboning for the rest of us who are trying to feel like we're doing something? So I don't know if that's really a question or if that's
Well, I'll
thought.
say the advocacy groups that we work with a couple, and they are probably some of the best partnerships that we have because they do so much, and we see so much tremendous value, especially these patient advocacy groups where some of our patient advocates are a part of that, right? And then also the amount of physicians and the providers. Like you look at the scientific ad board from some of these communities, it's some of the best of the best that, because again, they care, right? So definitely looking into those advocacy groups is 1,000% something that has been valuable, and I think we need more, right? There's only really one or two in my world, at least, in urology, so like we need to get more of those, right? So I don't know if that helped answer your half question or whatever, but
Yeah.
But we've worked with a lot of advocacy groups, and it's been great. I mean, I think in some ways they're a little bit more creative and creatively free. They don't have the regulatory concerns.
They don't need to deal with compliance.
They're not dealing with compliance the same way, and I think that we've been able to take more risk-taking kinds of projects where they entrusted us with more of the creative than sometimes we've had the experience on other kinds of things. And the results have been good. I mean, they got really, and I think it works because they trust their audience.
Also, what is the best is when you put out the work that you created with advocacy group, and then you look at the YouTube video where it is, and you see the community commenting and telling you like, that touched me. Oh, you're speaking exactly my language. You're telling me I'm not alone. And that's what you want to do. So yeah, advocacy groups are great.
So I think some of the reason why some of all the pharma advertising it feels flat, it all feels the same, it doesn't have is because every company does it the same way. And we spend an hour and we do these questions and then they go fast, and it's like, I got to get these questions done and there's not time to probe. And I think, what Kristen said, we do the 21 grams dinners, we do the spending the day in the life, and it does lead to, when you take the time and you do it differently, you get different insights. Yes. So this question is more for maybe if you have tips for us on, sometimes it's difficult to convince the client's research team to do it differently. And I get it, because you're in a large organization, you have to show the data it's done a certain way, and you have to get that data up the chain. But do you have any tips for the team of when we're talking how we might open the valve to different types of research? I think it's so important in just from a business perspective too, even forget the altruistic, that as we have to differentiate in increasingly crowded landscapes, you're not going to differentiate it. Everybody's going to the same methodology, same questions. You're going to get the same.
So I think I would start back, I think it all goes back to the market research aspect of like truly, and I know you guys are doing that, but like coming to the pharma clients with like real, true, tangible, I'm not saying you guys don't do that, but even like as much more information preparation possible, where you have examples of what's been done before. Like we know this doesn't work, okay? And to be honest, again, like you said, there's a lot of people that get involved in this, and a lot of decisions sometimes are out of the client's hands. With, from again, a legal, regulatory, there are a lot of restrictions, unfortunately. So, but I think just like you're going into any pitch, right, you want to be as prepared as possible to give, again, what good looks like, what's bad looks like, what has been done before, what hasn't been done before. And again, I think a lot of the times it also comes down to the right client, like if they truly understand. Because trust me, I've had a lot of clients who, and I'm sure in our experience, we just talked before, we had a lot of shared clients that, like, oh no, they just don't get it. Like, and I'm not saying that, but yeah, if I had to give tips, it's just using as many, like even like, because I deal with this on a day-to-day basis with my team on the 21 grams. If you guys are still listening, you'll laugh, Sabrina, Nicole, and Lydia. We have to tell so many experiences from other clients in the industry, like what they do, to like how that should make sense for us, right? So I think always using as many stories as possible from across the landscape, especially in a competitive landscape, that's always interesting. to really be able to get past some of those guardrails.
This was amazing. Thank you. And Kristen, even though you don't think of yourself as a hero, you're a fucking hero. I think everybody up here,
I'll take it
honestly,
today.
sharing these very vulnerable parts of your life is amazing. What I was going to ask is, both of you, Anna and Kristen, brought up like the in-between parts of like there's the treatment and then there's all of this stuff that happens like in between those moments, like acute periods of when you're getting treatment. What would you want to have heard from a brand during that time? Like is there something that you could think of, if it's a brand or even just from anyone during that time that would have helped?
Maybe, I think a lot of it, like when I was searching for ways to kind of deal with like the mental health impact that I had had going through this, I didn't know where to start, right? So I think something incredible that potentially some of these brands could take on is even just being like a connection point to resources in that way. Like, you don't need to provide us with a therapist, but is there a way to say, okay, in these zip codes, these are people who specialize in oncology, right? Or the experience you went through, like even just kind of like coming with that data just to connect you to that next step, especially when you're talking about the mental, would be so helpful. And I don't think it would actually be that much effort on the company's part either. But I was looking for like, how do I start to deal with some of this stuff? And I didn't even know where, like Google, I guess, but it wasn't that helpful.
No, Google's horrible.
Horrible. And honestly, the only way I even found my therapist who, specialized in EMDR, which is partial hypnosis that works through like traumas specifically, was my sister actually posted in a Facebook group saying, my sister went through this experience, she's looking for support. And so I think having someone that can take on like those connections would be so helpful.
We were talking about campaigns done well. So I remember for me, I lost my fertility. I cannot have another child, and that's one of the most painful things. But I already had a child. And for me, I remember how scared I was that what will happen to him? And how can I even approach this subject with him? And there is a campaign that's done very well. It's a children's book called Adventure Jar. And it talks about metastatic breast cancer and children. How do you talk to them? What is happening? And that's important, to try to capture not only the person, but think about what they are worried about. Obviously, life and death. But then they also have people around them, and they're worried about them. So give them a help, offer them hand. I love Adventure Jar.
We could use a lot of help with employment information about how to navigate employment, insurance concerns, loss of work, loss of income, all these things. So the things that would have helped us is if people were talking to us about the actual things that were keeping us up at night.
Yeah.
And then you will remember the brand.
You're creating a positive brand
Exactly.
experience.
Well,
And you're creating ambassadors.
Yeah.
Yeah.
Because Kristen, I know you brought this up when we talked too, right? That being able to deliver messaging beyond efficacy, right? And that there's still power in that, and how you connect with your patients and with your communities, because they now feel a loyalty to you. They feel a connection to you because you're giving them something that they need.
Thank you.
As we think about taking away learnings from this panel, I know everyone in this room has the opportunity to work on real client-funded work for clients in this space. In our day-to-day work, are there any opportunities you see as we, create campaigns in the oncology space or plan productions or ambassador programs or all these things where we can work in ways that bring greater authenticity to the work? I guess, what are some of the day-to-day things we could do as we plan those work streams to bring greater representation into them?
I would say don't forget that you're holding somebody's fear and somebody's lives in your hand. It's a lot of responsibility to not mess it up. But that's your North Star, is that person over there that might be getting your commercial, and through that commercial they will get information, and they might be becoming your future ambassadors. But it's a lot on you. So, but don't forget it.
I liked how you guys were talking earlier about embedding like a patient or someone who's had this experience within the process,
Yeah.
right? And again, we stop always at market research. And I thought it was really interesting that you're inviting patients to come in and frame IO with you,
Yeah.
right? To actually like roll up their sleeves and be part of the process to bring the work to life. I think that's something we could all strive for at 21 grams, right? To, at the appropriate junctions, pull someone in to really have their point of view shared and, again, be part of the creation of the work. It'll just make it so much better.
It's really interesting because I think that's like what I would suggest is like
Yeah.
keep an open mind. My mind was just open very much because we were working on stuff with the University of Maryland, and it came up that like for certain people, documentary form, like stuff that looks almost like shaky reality, like
Yeah.
horrible, people just trust that much more than, no matter how good the storytelling is, if it looks like there's a lot of money in it, they tune out. And that was kind of an eye-opener for me a little bit. Like I kind of sense that a little bit intuitively, but like listening to people and listening to what people are telling you about what they, because trends come and go.
Yeah.
And if we continue to listen, I think we can be ahead of those trends a little bit, so that people do feel like you're ahead of it and you're listening to our needs now, not once it's cool. Like I even think about that with our project. When we did it 10 years ago, I didn't see that many stories about young adult
Yeah.
cancer. Now it's everywhere. And we were doing it 10 years ago and people caught on like much later that was a story that needed to be told. And I just feel like we knew tons of people that had been going through that at that time. Just no one wanted to tell that story because they didn't think it was big enough yet to tell. And I think that's important too, is like, make sure we're telling stories that need to be told, not just because it might be the right time to tell it. Maybe the stories that need to be told now, it's because it's not the right time.
I wanted to add also to be flexible. Like you have your creative. We were just on a set with a survivor, and we had full creative. We didn't have enough time, but there was time still for asking questions. And so she knew I was a survivor too. So I started to ask her more questions. And the client was very happy. She was like, okay, this leads somewhere. And it led to an open conversation where the client cried. And so if you make your client cry, I think that's a good result. Yeah. Because it touched something that they weren't thinking about. You're kind of covering with your creative. You have to do it. Of course, you have to do it. But there is also space to add a little bit.
And I think too, being able to bring those experiences to the clients is another thing that helps, right? When the clients are spending time with their community, it's not just we're gatekeeping what we're hearing and we're sharing with them, like here's an idea because we heard this from a community. Give them a front seat with these communities so that they're hearing what we're hearing and gaining a deeper understanding of how people are living.
Yeah.
Thank you all so much.
Thank you.
It's been a privilege. Thank you very much.
I think it's really interesting to not just focus on the product all the time, but the holistic care of the individual.
I think it was really interesting. One of the panelists talked about sort of like including patients like in the process.
For me to be able to then carry that over into my work is going to be really interesting and super cool.
All right, Clay.